Hello, I'm James Ezimoha. Welcome to Africa News. Let's see your headlines. Health experts in Ghana welcome new malaria vaccines amid aid cuts in the region. Niger's military leader blames France, Benin and the Ivory Coast for an overnight airport attack. And the United States begins a $70 million expansion of the Manda Bay military airstrip in Kenya. We begin in Niger, where the military leader blames France, Benin and the Ivory Coast for an overnight attack on the country's main international airport. The government warns it could respond with what it calls foreign interference.
Gunfire and loud explosions were heard just before midnight on Wednesday around Niger's international airport in Niamey. The country's military ruler accuses France, Benin and the Ivory Coast of backing an attack. General Abdourahmane Tiani says those countries for sponsoring the overnight assault on Diori Hamani International Airport. He warned of retaliation, though no evidence was presented to support the claims.
We congratulate all the defense and security forces who knew how to coordinate their action, as well as the Russian partners who professionally defended their security sector. We remind the sponsors of these mercenaries, notably French President Emmanuel Macron, Benin President Patrice Talon, Ivorian President Alassane Ouattara, we have listened to them bark enough. They should also prepare to hear us roar.
Officials say 20 attackers were killed, while 4 Nigerian soldiers were injured. 11 people were arrested in connection with the incident. State television reported that one of those killed was a French national. Several aircraft were damaged while parked on the runway, with minor damage but no passengers or crew were hurt. Calm returned to Niamey by Thursday morning. Shops and schools reopened, although security remains tight near the airport. Since taking power, Niger's military leaders have cut ties with Western countries and moved closer to Russia, following a similar path to Mali and Burkina Faso, as violence linked to extremist groups continues across the Sahel.
The United States has broken ground on a major expansion of a military airstrip at Kenya's Manda Bay base, reinforcing security cooperation in the Horn of Africa. Officials say the upgrade will strengthen counter-terrorism operations and protect vital maritime trade routes.
The United States on Thursday officially broke ground on a major expansion of the Manda Bay military airstrip, deepening its security ties with Kenya in a strategically vital region. U.S. Deputy Secretary of State Christopher Landau took the controls of a digger, symbolically launching the project alongside senior U.S. and Kenyan military leaders.
We have to show those who would attack us that we are resolved to defend ourselves. And so that is what this outpost really represents. It is a very tangible commitment to the common defense between the United States and Kenya. I think that sends a very strong signal to those who would be our adversaries.
The upgrade will allow larger aircraft to operate from the base, which the two governments say will boost counterterrorism readiness and strengthen joint maritime security along the Horn of Africa. Manda Bay, a Kenya Defense Forces site that also hosts U.S. troops, has long served as a forward operating location for operations targeting extremist groups in Somalia and the wider region. It has also faced past militant attacks. Kenyan Defense Secretary Soipan Tuya highlighted the regional threats.
The security environment along our shores here and across the Horn of Africa, as we all know, remains complex, interconnected, and consequential to global stability. Piracy, human trafficking, and attacks on commercial shipping through critical checkpoints and threaten international trade and regional prosperity.
The $70 million expansion signals a deepening of U.S.-Kenya defense cooperation as both countries work to secure key maritime routes and address shared security challenges across the Horn of Africa.
New malaria vaccines are helping Ghana move closer to its long-standing goal of ending child deaths from the disease. Health officials say early results are promising, but warn global aid cutbacks could slow progress in countries where malaria remains most deadly.
Ghana's health service says the rollout of new malaria vaccines is contributing to a sharp decline in malaria cases and deaths among children under 5. However, they warn that funding cuts by major donors, including the United States, could limit vaccine access across Africa, where malaria kills nearly 500,000 children every year. For parents, the arrival of a malaria vaccine has brought relief after years of repeated hospital admissions.
Unfortunately, he was pronounced very ill, then admitted. During some few days later, he was transferred from that hospital to Ketekrachi District Hospital, and that was where the illness became very critical. Unfortunately, Isaac was pronounced dead. Phinehas as my second born, and then realizing, having the news that there is now a vaccine for malaria. In fact, I was really happy, joyful. In fact, that very day was Christmas for me.
Health officials say vaccination is already reducing the number of malaria cases seen in clinics.
We have seen the malaria cases decline. So, for example, in 2022, we had about 3,600 confirmed OPD under 5 malaria cases, that is in children under 5. We would count on the continual support of Gavi to provide some of these resources so that we can completely eliminate malaria from Ghana.
But vaccine providers warn progress could slow as funding becomes more constrained.
Gavi will still continue its commitment to increase the impact of the vaccine, just not at the pace that we forecast and the country passes for. So that's the real difference. It's the gap between what is the need, what is the promise of this vaccine, and what will we be able to realize with the resources that we have. And a twofold challenge. How do we work with the countries to prioritize the resources we do have available so that we're maximizing the impact of those? And then the second challenge is how do we generate additional resources so that we can actually realize that additional promise?
Ghana's experience highlights the promise of malaria vaccines while underscoring concerns that reduced global funding could leave millions of vulnerable children without protection.
A year's worth of rain in just 10 days. That is the reality of countries and communities across Southern Africa this week. While we often talk about climate change as a future threat, for over 1 million people in Southern Africa, it is a present, life-altering catastrophe. To help us unpack the humanitarian and the human cost behind the numbers, we're joined by Dr. Majore Mupandare, international humanitarian expert, joining us from Harare, Zimbabwe. Now, Dr. Mupandare, we've seen images of homes underwater, families displaced, and roads washed away across several Southern African countries at once. According to UN agencies and national authorities, tens of thousands of people have been displaced. From what you're seeing, who is most vulnerable right now, and where are the biggest humanitarian gaps?
Thank you so much. From what we are seeing across Southern Africa right now is not just a flood emergency. It is a climate and humanitarian crisis unfolding simultaneously across multiple countries. Homes, schools, clinics, and livelihoods have been swept away, and tens of thousands of people have been forced to move, often with nothing. The impacts are widespread, but they are hitting the most vulnerable communities the hardest. The people most at risk are those who are already vulnerable before the floods began. That includes low-income families living in flood-prone areas, informal settlements around cities, and rural communities that depend entirely on farming. Women and children make up the majority of the displaced. We are also deeply concerned about older people, people living with disabilities, and those with chronic illnesses who have lost access to care. In terms of gaps, the most urgent needs are healthcare, safe shelter, clean water, sanitation, Roads and bridges have been washed away, so entire communities are effectively cut off. That delays aid at the very moment that it's needed the most. And when schools and clinics are damaged, this crisis doesn't end with the water when the water goes down. It disrupts education and healthcare for months, sometimes years. Thank you.
Aid agencies often say the real emergency begins after the water recedes. Based on what we know so far, what worries you most about the next few weeks?
Historically, the most dangerous phase comes after the flood waters recede. What worries me most is the silent escalation of health and protection risks once media attention fades. As flood waters recede, we typically see cholera and other waterborne diseases spike, particularly where sanitation systems have collapsed and people are relying on unsafe water sources. Food security is another major issue. Crops have been destroyed, seed stocks washed away, livestock lost. That means hunger risks will rise sharply in the months ahead unless early recovery support is mobilized now. There is also a psychological toll. Families have lost homes, livelihoods, and a sense of security. Without sustained support, a climate shock quickly becomes a long-term humanitarian crisis. The flood, yes, may last days, but the consequences usually last years.
Dozens of health facilities across the region have been damaged or destroyed, cutting off access to HIV and tuberculosis treatment and increasing the risk of outbreaks, as you mentioned, like cholera. How does the region protect already fragile health systems when the infrastructure itself is being washed away?
Thank you. This is one of the most urgent challenges we have. When clinics are flooded or destroyed, it's not just buildings we lose. It's continuity of care, especially for people on lifelong treatment for HIV, tuberculosis, diabetes, and hypertension. In the short term, protection means rapid deployment of mobile clinics, pre-positioned medicines, and flexible treatment models, such as multi-month drug dispensing, so patients don't fall out of care. Healthcare workers also need safe transport and accommodation to reach the affected areas. But longer term, we have to be honest, rebuilding the same vulnerable infrastructure in the same places is no longer viable. Health systems must be climate resilient, elevated facilities, flood-resistant designs, decentralized supply chains, and early warning systems that allow services to adapt before a disaster strikes. Thank you.
Now, my next question is, local and international NGOs have set up temporary camps to house people displaced by the floods, but experience shows women and children often face heightened risks, including gender-based violence in these settings. What practical systems can be put in place to reduce that vulnerability during crises like this?
Thank you. This is a critical issue, and the solutions are known. We just need to implement them consistently. First, camp design matters. Having adequate lighting, lockable and sex-aggregated latrines, and shelters that allow privacy reduce risk significantly. Secondly, women must be involved in camp governance and decision-making, not treated only as beneficiaries. There also needs to be clear reporting and referral pathways for survivors of violence. Staff need to be trained, and there has to be a link to health, legal, and psychosocial support. Importantly, cash assistance, when designed safely, can reduce women's exposure to exploitation by giving them more control over basic needs. So protection is not an add-on, it's a life-saving assistance.
Researchers have linked this extreme rainfall to human-induced global warming, particularly fossil fuel use. Africa, as we know, contributes less than 4% of global greenhouse gas emissions, yet face some of the most severe impacts. In your view, is the global response through climate finance, adaptation funding, or disaster support matching the scale of the problem?
Frankly, no, it's not. The scale of climate impacts in Africa far outpaces the support being delivered. Climate finance is slow, fragmented, and difficult to access, especially for frontline communities and local institutions. Adaptation funding, the kind that builds flood defenses, resilient housing, and early warning systems, receives a fraction of what is needed. There's a profound injustice here. Countries like Zimbabwe and others in Southern Africa are paying the price for a crisis they did not cause. The global response still treats climate disasters as exceptional events when they are now a predictable pattern. We continue to respond reactively with emergency appeals after disasters, rather than sustained investment that reduces risks beforehand. What is needed is sustained, predictable financing for adaptation and loss and damage, not emergency appeals after lives have already been disrupted. This is not just a funding gap, it's a justice issue. Thank you.
And finally, looking ahead beyond the long-term goal of cutting global emissions, what practical steps, whether in policy, investment, or community-led planning, would make the biggest difference in reducing the impact of future floods?
Thank you. I believe the biggest difference would come from anticipatory and preventative action. That means investing in early warning systems that actually reach communities, supporting local disaster preparedness, and enforcing land use planning so people aren't forced to live in high-risk flood zones because they have no alternatives. It also means climate resilient infrastructure, roads, schools, clinics, and housing built to withstand extreme weather, and shock responsive social protection so families receive support before a crisis pushes them into poverty. Finally, we need to recognize that communities are not helpless. When local knowledge planning and financing are aligned, people can reduce risk dramatically. The challenge is political will, both locally and also at the global level, to act before the next disaster happens, not after. So we need to be able to invest more in preparedness, because with preparedness, we save more lives rather than the response phase. Thank you.
But that's all we have today in Africa News. Thank you for watching. Stay tuned to A News.